few months ago she sent me an invitation saying, would you like to come on this delegation that we're organising to Greece to find out about the impact of austerity on the Greek health service. And I it was only for 3 days, I mean self-funding, just pay your money. I sort of said yes without really kind of thinking about it, and I thought, well, that would be interesting, but didn't really put much more thought into it. And actually confess I didn't know that much about what was going on in Greece, partly because I'm so busy with other things here. So when I went to the delegation, it was with, I completely opened my eyes to something that I had not known really in any depth. And this delegation was mainly quite a lot of trade unionists and campaign. It was organised with the Solidarity Campaign. There were 17 people. There were people from various unions, Unite, the RMT, the Chartered Society of Physiotherapists, People's Assembly, People's Charter. There was a New Labour MEP. There was TSSA, which I'm not sure what TSSA is. Transport Service. And I think the General Secretary of that union was there. And there was also a lovely delegate from the cleaners that work at Canary Wharf. She's a Unite member. There's a whole lot of cleaners at Canary Wharf who successfully campaigned for the London minimum wage. And she came, she's a Latin American woman called Mary. She came and she specifically to express solidarity to the striking cleaners in Athens. And that was really very touching. Manuel Cortes, who's the General Secretary of TSSA, Sarah Cook for Unite, so a bunch of people. It was meant to look at the impact of austerity on the health service, and so it was quite a lot of health workers there too. And it was only 2.5 days of seeing people. We had really good access. We went to the main hospital in Athens, which is the biggest hospital in the Balkans, called Evangelismos. It actually serves the whole of the south of Greece, and Greece has got a population of 10 million. We met Syriza MPs. We met local people working in local government. We went to solidarity, volunteer clinics, and food markets, etc. So what's happened is that in Greece, there was this thing called the Troika, which is IMF, European Bank, and some other bank, imposed extreme austerity on Greek economy, and actually led to the decimation of the public sector in return for being given so-called bailouts or loans to help. But the billions in loans never went near the Greek people. They just went straight to paying off bank loans. So that's all happening at that level. Meanwhile, the state and the public sector is decimated. So I hadn't realised how far something could go. So 30% there's 30% unemployment in Greece now, and amongst youth it's much higher than that. Unemployment, lots of public sector workers have lost their jobs, people in the countryside have become destitute, people in towns are becoming destitute. There's actual starvation, there's real hunger. A large percentage of the population don't actually have enough to eat. There's a destruction of the health service, which I was so utterly and completely shocked. They never had what we had, the primary healthcare system and NHS we had, but what they had was a system of two things. In the community, they had things like polyclinic type things where you could go straight to see a specialist, but at least they were located in the community. There were some family doctors, but mainly you go directly to specialists, so in these sort of polyclinics. All the polyclinics were shut. All of them were just shut down, so nobody had anywhere to go. They recently reopened a third of them, which still is not nearly enough to meet the needs. But at the same time, people got healthcare through an insurance system. And you got your insurance through your job. So if you were employed, your employer paid for your healthcare. So obviously with 30% unemployment, and these are people who are actually then poor, they can't afford private and they don't get health insurance, so they've got no access to healthcare. Absolutely no access to healthcare. So you have a situation where the only access to healthcare is like emergency care. So this big hospital, Evangelismos, is on call 1 in 4. We had a meeting, we went into the hospital, and there was a big meeting of staff, nurses, doctors, physios, pharmacists, all were there to meet us and tell us about it. Loads of the staff had been cut to the bone. They found it really hard to provide services for their patients. They found it really painful because they're supposed to bill patients, and they realised patients couldn't afford it, people on renal dialysis. So they said, we just break the law, we just don't bill them, we're not supposed to, but we can't not treat them, or we sort of fiddle it in different ways to make sure that people get treatment. But on the day that they're on take, the A&E, the doors open, 1 in 4, and it's just people flooding in. People with chronic diseases who shouldn't be going to A&E, people with diabetes who need their long-term care, their long-term medication, coming to A&E to try to get a few diabetic pills. Children are being taken to be immunised because there's no, immunisation's collapsed. It costs £80 for a course of children's immunisations, and most people can't afford it. So you've got a situation where the infant mortality rate has increased by 40%. 40% increase. This is in the Lancet medical journal. And the HIV rate is multiplied times 7. The TB rate has doubled. The suicide rate has increased. They've closed lots of mental hospitals. People wandering the streets in extreme mental distress. And when I went to the Evangelismos hospital, they said that their 25-bed psychiatric ward was full to overflowing with all the extra psychiatric patients that were being brought in off the street because they were so ill. And I asked if I could go down and see it, and we didn't want to go like a whole bunch of tourists watching, so the 3 of us who were all health workers were taken down. And I've never seen anything like it in my life. I've worked in the third world. To think this is a first world country. So this is you walked along a long corridor, and on both sides of the corridor, on both sides were the kind of A&E trolleys. You see the beds you get in A&E, kind of narrow beds, all the way along one very long corridor, and then round the corridor another long corridor. Probably 50 to 100 people stacked up that way. This is their personal space. These are people with acute mental illness, men and women, old and young. Between them they had 2 toilets. Between them they had 1 psychiatric nurse, who was lovely but said, we can't do any therapeutic work for people. They were just lying there on these trolleys, completely apathetic looking. It was actually really quiet, considering how many people were there. So this is something that actually brought tears to my eyes. It was unbearable to watch. So that's acute care. Primary care, as I say, has collapsed. Having babies. So we spoke to an obstetrician who came along, and she was fantastic. She said that if you have a baby in hospital, they charge you €600. If it's a cesarean section, it's €1,200. If you're non-Greek, if you're a foreigner of any kind, a migrant or whatever, you're automatically charged double. So that would be. If you can't afford to pay the fees for having your baby, what they were doing before was they were keeping the baby back, and they were giving you your baby until you could come and pay. I read about that. There was an international right crime. I was reading about it in The Guardian or something. So they were so embarrassing. They stopped doing that. But they just changed the law. So at the beginning of January, they changed the law so that they tried to get, I think, something like national insurance or a tax number off you, either you or a member of your family or a relative, and they tried to get the payment through the tax system. If you're not paying tax, they can actually now, by law, they changed the law, they can actually confiscate your property. So you can have your baby and find that your home has been confiscated or your other property has been taken. Or if you can't even pay that way, you can be imprisoned. So what this obstetrician said is like it's the criminalisation of childbirth. Something as fundamental as childbirth. So what's happening is that lots of women not wanting to have babies now. So the abortion rate, this is a population of 10 million, was 300,000 abortions last year. People just, it's cheaper to have an abortion than to have a baby. Contraception isn't covered either not even private healthcare. Private healthcare insurance doesn't cover contraception because it's considered to be a lifestyle choice rather than a healthcare requirement. So lots of women can't get access to contraception. People can't really afford to feed existing children. You've got families where we were told the entire family is dependent on the pension of a grandparent. Pensions have been cut, but a grandparent might be living on €400 or €500 a month. Entire family living off that. So people are being forced into not just poverty, but actual hunger. So that's healthcare, hunger, infant mortality rising, the state of primary care being decimated, secondary care also a mess. One of the health workers that took us round, lovely woman, she was a radiographer, she was actually off work because she's sick, but she took us into the hospital to meet her colleagues, was in crutches, and she was in a kind of splint with her knee. Her knee had been really badly damaged because 3 weeks previously, when the health workers had been on strike and there had been a picket in their hospital, they're striking over pay and conditions, the riot police had come into the hospital grounds and beaten them up. And this woman had had her knee smashed by a riot police boot who kicked her knee in, so her cartilage was all damaged. She brought her an operation to see that anything heals by itself. But, you know, she's just a person just like you and just like us. And that's the price they pay. 90% of the members of the riot police are in the Golden Dawn fascist organisation. We also, near where we were living, in Central Hotel, there were the striking cleaners. So there were a bunch of cleaners, about 600 cleaners who all work for the state. They work for the Ministry of Finance and other ministries. About a year ago or so, they were told they were going to be A, privatised, and B, their pay was going to be reduced to €2 an hour. So they, the ordinary women workers, women cleaners, they all went on strike and they were all sacked. So instead of giving up, for the whole year they kept up this constant picket outside the Ministry of Finance, where just women sitting behind a sort of, a table, you can imagine it, with some leaflets and some badges, and anybody who wants to come up can go talk to them, and there's a couple of handmade banners hanging above. Just completely harmless, innocent looking, constant police presence by their side of about sometimes 6 to a dozen police, sometimes in full riot gear, just standing there to try and intimidate them all the time, because we were walking up and down all the time. We were quite tired, we passed them. So the delegation, I wasn't at that bit because we were sort of split up in different ways. The delegation actually, with the cleaner from Canary Wharf, went and gave a presentation and gave gifts and exchanged things to these cleaners. So just to cut long story short, of course there's resistance to this. There's resistance, there's always resistance. So there's the two bits of resistance that we witnessed. One is the sprouting up of solidarity clinics, health clinics in the neighbourhoods. There's about 60 of them across Greece, with volunteer doctors, nurses, pharmacists, physios, and so people from the community volunteering. And we went to visit one in this community called area of Athens called Peristellis, 400,000 population. And it was great, but it was very, very basic. Somebody had given their house over, basically. And there was just a room with a little examination couch, and there was a kind of pharmacy with donated medicines. People were really lovely there, and there were all loads and loads of volunteers, and also volunteer teachers who say that they actually identify children and families in the schools that are in need, and they bring them into the clinics and things. So there's a network in the community, and they call themselves the social solidarity. And similarly with hunger, with feeding, there's this arrangement where they're bypassing the middleman, the supermarkets. They're going straight to the farmers, and people are ordering food directly from the farmers, where the farmers are then delivering. This is once every 3 months. We went to one of the markets, and there's like huge big cheeses and pasta and all these things, and honey. The farmers and people then get their goods that way. So the farmers get a good price, the people get the stuff cheaper, the food cheaper. But what happens if farmers donate 5% of that food free, which is then distributed to people who are hungry? And that's all done through the Solidarity Network. No money crosses hands. They don't want any grounds for any accusation of corruption. They don't want banks to take money away from them. So it's all done through this sort of amazing structure. And what they said to us when we spoke to them, they said, we don't want charity, we want solidarity. They said, solidarity, not charity. And there was a lovely banner in Greek over the market that said, putting hope into practice, which I thought was a lovely combination of this great hope, because the whole idea of the solidarity networks is not that they're saying, well, this is going to be a great substitute for the state, we should just, they want the state to be providing care they need, but what they're saying is this is keeping people's hope alive, it's keeping people's networks and support alive, it's actually keeping people alive, and it's forming a sort of basis of some kind of resistance. As well as that, there is a political resistance. So a few years ago there were big demos in all the squares, but that's died down, but that's partly because people are expressing some of their political hope through the party called Syriza, which is one of the left parties, which has actually got big growth in support, and it could be the next government. The opinion polls suggest it could be the next government. I didn't go, I missed that because I went to do the visit to the psychiatric ward, and I thought it was important. So some of the delegation went and spoke to a leader of Syriza and other MPs in Parliament. And Syriza's demands are very progressive. So, for example, the taxation system at the moment is 70% tax is taken from the poorest 30%. So people who are poor, who are unemployed, who are destitute, are having to pay loads of tax. And the very rich pay almost no tax. In fact, there's a law that means that if you are a shipbuilder, you don't have to pay any tax by law. So, and shipbuilding is a big Greek industry. So the Syriza demands are, I'm going to stop soon, but the Syriza demands are, our predictions Its principle was that not 1% would go back to the payment of interest on the loans until the needs of the Greek people had been met. He said that pensions would be restored to pre-2008 levels, as with the minimum wage, which has been cut by a third already. And he said anti-labour laws would be repealed. He said banks would be socialised and forced to create loans for new business and employment. Sorting out the 60% youth unemployment would be front and centre. He said the health service would be rebuilt. He said taxation would be reversed from its current position where 70% of income tax is paid by workers, the unemployed, pensioners, and 30% by business and the wealthy, and where 60% of the tax burden is carried by indirect taxation. These and other priorities would be enacted directly without delay. So a progressive programme, if they got elected, our sense was that there's an undercurrent of, not just undercurrent, but there's a presence all through Athens of the riot police and the police, and there could be, you know, I don't know, maybe even a military coup or something. I don't know, that it could be. I feel that what they said is, we don't want you to look at us as a basket case, as charity. We want you to see us as this is the front line we fight against austerity. This is what can happen when austerity goes that far to decimate. And I remember thinking to myself, you know, okay, that's really bad, but I couldn't quite picture it happening here. Except I just read something by Deloitte, just done a study, that only a tiny fraction of the welfare and benefit cuts and public sector cuts have actually happened so far, and the bulk of it, there's a graph that's going to happen in the next 5 years. So, you know, they're saying, you know, watch this space. This is what, and therefore why helping us to defend ourselves and our public services against austerity is part of the European-wide fight. But I just felt so moved by these lovely, warm, wonderful, normal, ordinary people like us who are just wanting to keep their society together.